Hello and welcome. My name is Christine and I have Common Variable Immune Deficiency, aka CVID. Today I would like to talk about the treatment for CVID and some of my experiences that I have had on the different types of treatment. First and foremost, for the majority of people who have CVID, the primary treatment is some form of immune globulin replacement, such as IVIG, Intravenous immune globulin, or SCIG, Subcutaneous immune globulin. How this works is you get injected with the immune globulin that your body is not able to produce enough of to help provide you the protection that you need in order to stay healthy. In an easy explanation, immune globulin comes from people that donate plasma. They pool several different people's plasma together to make one lot. The reason why they do this is to provide a wide range of antibodies to give you the best protection against several different illnesses. What are some differences between IVIG and SubQIG? With IVIG, the treatment is less frequent. Typically, people that do IVIG get it every 4 weeks, sometimes they get it every 3 weeks. With IVIG, a lot of people report unwanted side effects. These side effects can include muscle aches, headaches, fatigue, and a general unwell feeling, which people tend to describe as a flu-like feeling. Side effects can be reduced by decreasing the rate of the infusion and by infusing saline alongside the immune globulin to help dilute the medicine a little bit. Some doctors also pre-medicate the infusion with steroids to help decrease any inflammatory reaction and or with Benadryl. IVIG can be done either in your home or in an infusion center. The first time you get IVIG done, you are going to want it to be in an infusion center. Because immune globulin is a blood product, there is the risk of going into an anaphylactic shock. Until you know how your body reacts to it, you want to be in a place that can handle such an emergency right away. Once you know your body is okay on a given brand, many doctors seem to agree that it's okay for you to get the infusion done in the home, which is something that a lot of people would prefer. An obvious benefit of getting it done in your home is that people are more comfortable in their house and you don't have to actually get up and drive anywhere. This is really important, especially if you are getting Benadryl with your infusion. I know with me, when I was having to get IV Benadryl with my infusions, it would pretty much knock me out. And it's not something that you would want for driving. With IVIG, the infusion tends to take several hours. I know with me, when I got my infusions, they lasted about 4 to 5 hours. The time depends on what your dosage is, how much you have to infuse, and how fast the rate is. With subcutaneous IG, the treatments are more often. It's something that can be worked out with your doctor as what is best for you in order to stay healthy. Typically, it is done once a week. I have heard of some people that do a very small dose as often as once a day. At one point, I was doing mine every 10 days. A lot of it depends on what brand you're doing, how your health is. It's one of those areas where you can really have an open conversation with your immunologist to see what your different options are. There are some newer brands that can be done once a month. I have never used them, so I really don't have too much information about those. With SubQIG, people typically report less side effects. I would say the biggest benefit about SubQ is that it can be done at home and on your own schedule. You completely do it independently. So if you typically do your infusions on Wednesdays and this specific Wednesday you have an event and you can't infuse, you can do the infusion on Tuesday or you can wait till Thursday. It's not going to be a huge deal and it's really not going to make a big difference. It's much more convenient the way you can alter it around. You don't have to rely on a nurse and your nurse's schedule. It really makes things a lot easier, especially if you're in school or if you work. You can do your infusion in the middle of the night if you want to. You can do it early in the morning. It's really what works best for you and your schedule. Another benefit of SubQIG is you have a more balanced immune globulin level throughout the month. With IVIG, when you get your infusion, you start off with a really high trough level of immune globulin, and then it slowly goes down throughout the month. Then you get the infusion, it's high again, and then it goes down. With SubQ, it is much more at a level pace. You don't have this huge peak and fall down. With IV, I know a lot of people really feel it when their infusions do because they are getting at those lower levels. The typical infusion time for SubQ is less than that of IV. For me, my infusion time takes about 90 minutes. SubQ is more needles overall for anyone that has a phobia of needles. But if you have CVID, let me tell you, you are going to have to get over that phobia pretty quickly. With me, I use 4 needles with each infusion. At one point, I was using 3. If you think you do it once a week, that's 16 needles in a month, whereas with IV, it's typically 1 needle in a month, unless you have bad veins, in which case they have to stick you multiple times. So what are some of the experiences that I have had with IVIG and SubQIG? When I first started immune globulin, the first thing I started with was IVIG. I used Octagam. I used this treatment for about 2 years. I really don't recall any huge side effects with this medication, and I tolerated it very well. However, during my first year away from college, I had enough of trying to schedule my infusions with the nurse. I had some issues that came up. I decided that I wanted to try SubQ. So my doctor did the paperwork, we changed the prescription, and I got on Vivaglobin, which back then was the only brand of SubQ for immune globulin. Today, it is no longer even on the market, and there are just several different choices to choose from. I remember the first time I had the nurse come and teach me how to do SubQ, I almost fainted just at the thought of sticking myself with a needle. I really did not like it, and the first time she came out, I actually ended up not doing any of them. I was so petrified. I would not say I ever got over that dislike of sticking myself. It is something that I definitely just have to work through because it is what it is. Approximately 6 months after starting the Vivaglobin, I started to develop hives shortly after the infusion, and they would last about 4 days. So by the time they went away, it was time to infuse again, and the hives would come back, and that ended my use of SubQ at the time. I went back on IVIG using Octagam. Less than a year after getting back on the product, it was voluntarily withdrawn from the market in the United States, and it was actually suspended in the European market due to an increase in unexpected blood clots, which isn't a very comforting thing to hear. Thankfully, nothing ever happened to me. The product has long since returned to the market, and they did a lot of research on making immune globulin safer. Since this time, I have never been back on it. Octagam was off the market. I could not use subcutaneous Vivaglobin. I had to get on a new brand of IVIG, and the brand that my doctor chose was Phlebogamma. One of the important things with immune globulin is that each brand is not created equal, and since it is a blood product, different people have different reactions to different brands. This is very important for prescribing. What works well for one person does not necessarily work well for another person. Some of the troubles that have come from this, at least in the United States, where our healthcare is a little bit of a mess right now, some insurance companies like to give all the patients the cheapest brand possible. And they cannot do that because some people just cannot tolerate certain brands. For example, I cannot tolerate Vivaglobin because I get hives, and I cannot tolerate Phlebogamma. Against wise medical recommendation of getting a new brand in an infusion center or in a hospital, I had to get this one in my apartment because I was away at school. It was just way too inconvenient to be able to drive down to where my immunologist was. Yes, there are hospitals in Gainesville where I went to school but my immunologist does not have prescribing rights to those hospitals. It's not like I can just go to them to get the infusion. Here I am in my apartment. I am getting my first infusion of this Globulin. I'm talking to my nurse. I start noticing this weird burning sensation in my throat. At first, I really did not think much of it. I didn't say anything, but quickly after I felt this burning sensation, I struggled to breathe and I could no longer really talk and make out full words. What was happening was I was going into a bronchospasm and my airways were starting to close. From what I understand, I was having essentially an allergic reaction to this Globulin. Thankfully, this nurse that I had at the time was very good. We didn't really have much on us in my apartment to treat this reaction. I did have an EpiPen, but I did not want her to use the EpiPen unless it absolutely came to it. If you get the EpiPen injection, then you are going to have to go to an emergency room, and I really did not want to do that. I mean, I had to go to the football game that night. Priorities, right? I ended up okay not getting the EpiPen. I had oral Benadryl in my room. The nurse stopped the infusion. She gave me the Benadryl, which takes about a half an hour to kick in. Slowly, my breathing started to get more normal. I do remember when I was at like the peak of struggling to breathe, my nurse took my blood pressure and it was really, really high, and I did think she was gonna have to call an ambulance to take me to the hospital. It was, in reality, very, very scary. It passed. I was okay. At my request, the nurse did finish the infusion. We just did it at a much slower rate. I knew I needed my immune globulin to stay healthy, and I really did not want to throw away the remaining immune globulin. Looking back, I am thankful that I had this reaction because I did end up having after this a period where my insurance was trying to pick a brand for me, and my doctor was able to easily give this occurrence as a reason as to why they cannot just pick random brands for me. The next thing I went on was, again, IVIG, and I used Gamunex-C. By the time I got on Gamunex was during my winter break, and I was actually able to get my first dose of Gamunex in a hospital infusion center and make sure that I was okay getting this one. I did pretty well on this. I do remember at one point I felt that burning sensation in my throat because I was kind of fearful of having that whole occurrence where I couldn't breathe again. I had urged that nurse to give me the IV Benadryl. Since then, my doctor had put it in the prescription that I had to get the IV Benadryl before each infusion. And let me just make a note. I have never appreciated how fast your blood moves through your body and across the blood-brain barrier until I had IV Benadryl. Seriously, they push it. It's like instantly you just feel like a wave has like blown over you. You feel a little out of it. That stuff will make you very sleepy very quickly. I ended up using this treatment option for a few years until I was about 1 year into my physical therapy program. I was really struggling to schedule my infusions where it fit around my classes, where it fit around my nurse's schedule. My nurse was really busy. It was extremely challenging. I ended up a lot of times having to do my infusions on a Saturday morning, which was not really convenient, especially because I had to get the IV Benadryl before each infusion. On one of my 2 days off, I had to wake up, I had to get the IV Benadryl, and that basically put me to sleep for at least half of Saturday, which took away a lot of studying time and really social time that I could have had while I was in PT school. I decided to go back onto Subcutaneous IG. Thankfully, by this time, there was several different products to choose from. I didn't have to go on the Globulin, which I was allergic to. Gamunex-C is one of the products that can be administered both intravenously and subcutaneously. Since it was working for me in the IV form, I just stayed with it for the sub-Q form. This is the product that I am still using today. I've been on it for almost 6 years now. It's kind of crazy to think about. I still do not like sticking myself with needles. I do dread each infusion, but I know I have to do it because if I didn't do it, my health would really suffer. Side effect wise, I don't really have issues with the Gamunex. I have been mostly healthy. It's just the side effects of the infusion itself that I really don't like. I feel this like burning sensation sometimes. Sometimes when I stick myself with the needles, I don't feel anything. Other times it's very painful. I must say with Sub-Q, the biggest benefit that I do definitely still enjoy is the fact that it's a flexible schedule. I can do it whatever night I want, whatever day I want. If I want to go on vacation, I can do a dose a little bit earlier. I can do a dose a little bit later after my vacation, and it's really not a huge deal. I don't have to worry about scheduling my trips around my infusions. For Sub-Q, what you do is you have your vial of medicine, you draw the medicine up into a syringe. I use two 60 ml syringes, so they're pretty big. You draw the medicine up into that, you put this rate tubing on the edge of the syringe, and you attach the rate tubing to the needles. I use a quadricated set, so I have 4 needles. I stick all the needles in me, you attach it all up, and the syringe goes in. This is a Freedom 60 pump. Not everyone uses this, but it does seem to be the more common one that is used. You put the syringe in here, you turn it on. This little black thing pushes the syringe down, and the speed that it goes has to do by what rate tubing you have attached to the syringe. It is pretty simple, it is easy to learn. I know it can be kind of scary and daunting. After you do it several times, it's really not that hard. The places that you stick yourself typically are your stomach and your thighs. But with that, I would like to say, talk to your doctor about it, because I have heard some people say they have been told only to do it in their stomach. I do it in my thighs. Go with your doctor's advice. That is my video about CVID treatment. Thankfully today there are a lot more options than there used to be, so you can really get on the ideal treatment. I hope you enjoyed my video and maybe learned a little bit. If you did like it, if you can give me a thumbs up, and I hope you have an awesome remainder of your day wherever you are. Bye!